You are joining the National Center for Medical Legal Partnership today, January 11th, 2024 at 1 p.m. Eastern Time for a really special MLP in Action webinar that focuses on climate change and climate action. So welcome to today's HRSA-funded webinar using Medical Legal Partnership, or MLP, to understand and address the health harming effects of climate change. Thanks again for joining us. Let's continue to advance slides and get into the meat of the material. You're hearing from me, Bethany Hamilton, co-director of the National Center for Medical Legal Partnership. I'm very happy to be joined by one of our trusted consultants, attorney Katie Hathaway, who will be moderating the audience Q&A towards the end of today's presentation. Next. As I mentioned at the top, today's webinar is supported by our cooperative agreement with the Health Resources and Services Administration. So the National Center for Medical Legal Partnership is in its 10th year as a national training and technical assistance partner with HRSA. That's how folks get to take advantage of these national audience trainings and resources that are often presenting information that is transferable across different MLP types and settings. Next. All right, so basic housekeeping. What I'll highlight here is that if you'd like to activate captions, please use Zoom to select live transcript and show subtitles. Also, please feel free to send a chat to the host and panelists so that we can address your need for assistance, and utilize the Q&A to send questions to the panelists today. And everything will be recorded. The slide deck will be available on our website under the resources section. All right, so for today, we are joined by two subject matter experts. Attorney Christina Russo Walters, who's Senior Managing Attorney, Medical Legal Partnerships at Community Legal Services of Florida, and Dr. Frederick Anderson, Associate Professor and Medical Director at FIU, or Florida International University Mobile Health Center. I want to thank Christina and Fred for joining us today. You'll hear more from them in just a moment. Next. Today's learning objectives at the high level are to deepen your understanding of how climate change disproportionately affects the health outcomes of underserved patients and communities. We're hoping you will also feel empowered through partnership. The MLP approach in particular, we believe you'll step away understanding how you can use it to screen patients for climate-induced social risk factors, and then learn how to work collaboratively with lawyers, legal professionals in particular, to address those legal needs and barriers. And then we're hoping you will also build your preventative capacity. In other words, using MLP to proactively take upon your health center or healthcare organization strategies, more preventative measures to mitigate the health harming effects of climate change. Next. So let's kick off first with some level setting. Many of you may have heard this before, but we're hoping that those who are new will find this information helpful. Let's talk about the medical legal partnership approach. Next. First, where do legal services fit within an SDOH strategy for a healthcare provider or the system? First, let's remember we're talking about the social determinants of health. That these are the conditions or factors related to where someone is born, grows, lives, or ages. It includes political systems, policies, social norms that all contribute, as we know, significantly to the health disparities. Of the social determinants or drivers, we have sort of needs that arise. These are the more immediate, individual, or even community-based needs that patients are showing up with, and that results in barriers to their improved health outcomes. Within social needs, there's a separate category or subcategory of needs that we define as legal needs. So simply put, this is the subset of social needs that have legal solutions. Let's talk about medical legal partnership and how it helps legal services actually fit into a healthcare provider's response to social drivers of health. So MLP is an intervention. We're actually bringing together legal and healthcare professionals to collaborate to be able to resolve those social, economic, and environmental risk factors that contribute to the disparity and have a remedy in civil law. This is a very flexible approach. It is evidence-based. It is a public health tool, and it is a social justice intervention. It works at the individual level to provide legal assistance. It helps healthcare providers get trained up and build their capacity to actually screen for and address legal needs. It helps to improve through clinical level changes, the clinical practices at a health center or other type of healthcare provider, such as the hospital. And then it goes all the way upstream to address policy level strategies that can help effectuate change in population health or for communities. Let's go to the next slide. Thank you. So those of you who are familiar with medical legal partnership and MLP's presentations will find the iHelp chart on the screen to be very familiar. By iHelp, this is how we like to describe what legal services can do to help address social determinants of health in a way that is easy to communicate between both disciplines. And the I in iHelp generally stands for income and insurance, H, housing and utilities, the E, education and employment, L, legal status, such as, for example, veterans or one's criminal history record, and the P addresses personal familial stability issues. Just want to hone in on the housing and utilities example on the screen. This is where legal services can step in to prevent eviction, but also protect against utility shutoffs. As a result thereof, patients are able to secure their housing, and they're able to also ensure that utilities such as heat or electricity remain on so that they can adhere to medication or medical treatment plans. Next slide. All right. So the medical legal partnership field is continuing to grow. In total around the country, we are estimating till around about 500 MLPs of all types around the country for the health center based MLPs, health centers being the health center program administered by HRSA under the Public Health Services Act. They serve about 31 or 33 million, I believe, patients a year now. 1 in 3 of those patients are uninsured, 1 in 3 are estimated to live in poverty, and 1 in 7 are rural residents. This is where about 150 to 200 health centers operate MLPs to serve the needs of that patient population. This is a shared population that's also served by civil legal aid, but we do know that on the civil legal aid side, there's a major justice gap. So it's really important to recognize the role that healthcare providers have played in creating access to justice and not just access to care. And the MLP approach helps us to ensure that we have identified partners who can share what services they provide and help us identify gaps that need to be filled as well on the civil legal aid side. So I want to really acknowledge and thank all of the healthcare providers who have taken on the MLP approach. And because this is a HRSA funded webinar in particular, say kudos for the growth that we've seen in the health center MLP field, especially since 2014 when there was a policy change that allowed for additional growth. But much more is to be done. And let's transition now to hearing from the subject matter experts about what we can do on one of the greatest issues of our lifetimes, that is climate change. And what can MLP do to help you better understand what climate change is and how you can address the health harming effects of climate change on your patient populations. Again, you're going to hear first from, let's go to the next slide, Christina Russo Walters of Community Legal Services Mid-Florida, and Dr. Frederick Anderson, Associate Professor and Medical Director of FIU's and the Mobile Health Center. Fred or Dr. Anderson, I'll pass it on to you. And thank you so much again for presenting today.
Thank you so much, Bethany and Katie and Reha, for that warm welcome. I'm very excited to speak with all of you today and to work with the National Center for Medical Legal Partnership. I'm a family physician by training, and I have the privilege of serving as the medical director for FIU's Neighborhood Health Program, where we help care for an underserved population here in Miami-Dade County. And we have seen firsthand some of the negative effects that climate change is having on these populations. And I also want to just recognize that I am a member of the Florida Clinicians for Climate Action, and I very much appreciate their help in putting this slide deck together. We'd like, before we go into the topic of the health impacts from climate change, to learn a little bit more about the audience. So we would love for you to tell us if you are either a healthcare provider or worker, or perhaps you're a legal advocate or a lawyer. If your answer is neither of those, please select other, and we would appreciate to learn from you, perhaps by your answer in the chat, so we have a better understanding of who is joining us today. And thank you, Reha, for doing that poll. I'm not able to see the poll results on my end, but I don't know if that's something that can show up. Okay, wonderful. Thank you so much. So it looks like we have maybe about 19% healthcare providers, but the vast majority look to be in the legal sector, which is perfectly fine. And thank you for those of you who are coming in from perhaps the environmental advocacy side as well. Next slide, please. So just a quick overview. I hope to provide maybe some of the medical and scientific understanding of climate change and its impacts on health. We should probably address what climate change is and what is driving it. Simply described, it is the phenomenon where solar radiation that typically enters the Earth's atmosphere, a substantial portion of it will get reflected back out to outer space. But greenhouse gases, primarily those that are driven by the burning of fossil fuels, such as carbon dioxide and methane, have an effect where within the atmosphere, they can trap this solar radiation and hold on to that thermal energy. And this perpetuates a cycle where there can be additional thermal energy stored, and that can drive climate change and global warming. Next slide, please. We do recognize that there has been a debate, perhaps more in the political sphere, about what is driving climate change, whether it's really happening. Most of us, certainly in the climate science community, believe that the debate is settled, that by the latest estimate, 97, 98% of climate scientists agree that it's really human-driven activities that are driving climate change. This is recognition that there is, of course, natural phenomenons such as the El Nino, La Nina effect, perhaps volcanic eruptions, those kinds of things that can have effects on the temperature that we are experiencing. But if you are tracking from the pre-industrial era to modern time, you do see no longer just the global temperatures that we're experiencing corresponding to natural fluctuations, but seem to be corresponding much more with the global burning of fossil fuels. This slide we've just had to update. Unfortunately, the trends are not moving in the right direction. According to the European Union Climate Monitor, they just announced on Tuesday that 2023 was, as feared, the hottest year on record. They had now clocked it as we're now 1.48 degrees Celsius higher than the pre-industrial average, which is about 2.66 degrees Fahrenheit. And these are all concerning trends that we continue to witness. Next slide, please. Now, in addressing a topic that's frankly very complicated and sophisticated, such as climate and its impacts on health, it has been helpful for us to rely on certain mnemonics, such as what you're seeing here. I want to thank again the Florida Clinicians for Climate Action for bringing this to our attention. This is often very helpful. We use this in terms of handouts for our patients and to some of the community partners that we present to, where we emphasize, of course, what you see here: heat illness, exacerbation of heart and lung conditions, asthma, traumatic injuries, very much from windstorms, for example, the deterioration of water conditions and water and foodborne illnesses, the preponderance of allergy or allergic illnesses increasing, vector-borne diseases, and emotional stress. And I'll be going over these quickly over the next few slides. Next slide, please. This is a nice diagram courtesy of the Asthma and Allergy Foundation of America, just trying to perhaps describe the multiple ways in which all these different systems can interact with one another. It may be intuitive, and most of us may be familiar with how, as increased air pollution here at the top right around 12 o'clock can certainly exacerbate asthma. As there's more extreme weathers, you can start to have impacts on different biologies of different animals or insects and plants, and you can start to have impacts on vector ecology. You can start to have an increase in allergens in the air. Water quality can be impacted. As sea levels rise, that of course can represent another direct threat to the quality of water that we all rely on. And food and agriculture itself can become tenuous due to some of these sustained impacts from climate change, leading to environmental degradation that can have societal impacts where people can no longer rely on agriculture and be forced to migrate in order to support their families. And this can lead to civil conflict. And of course, there's extreme heat that can be so deadly in impacting the health of our communities. So we recognize that this is very multi-dimensional, but we do believe that these kinds of diagrams can help us conceptualize some of these different levels of interaction. Next slide, please. Unfortunately, climate change does not affect each and every one of us equally. The vulnerable communities, the vulnerable amongst us, tend to be on the front lines of suffering the consequences of climate change. Historically, disenfranchised communities, perhaps communities of color, as many of us on this webinar perhaps be aware of, they may be living in areas, perhaps due to redlining or historical situations like that, that their housing may be closer to polluting industries, closer to large interstates where there's a lot of car exhaust, and children and adults in those circumstances may have an increased incidence for asthma or other airborne illnesses as a consequence. Older adults, just as all of us age, we physiologically start to resume or lose our ability to adapt to some of the environmental changes around us, that older adults can be overwhelmed by heat. They cannot move as readily as you and I. Perhaps they may have some disabilities, and that may make them more susceptible if there's a power outage or what have you, and they may suffer the consequences. Low-income communities, of course, may not have the resources that they need to be able to adapt and perhaps put in climate mitigation strategies, or if they're negatively impacted by climate disasters such as Hurricane Katrina. Unfortunately, the lower Ninth Ward to this day looks to still have longstanding consequences from that hurricane in 2005. So we're just recognizing that many of these climate impacts on these communities, not just on health, but on their overall well-being, continues to affect those most vulnerable. Children also, because of their smaller size, their greater surface area relative to their weight, they can actually have more susceptibility to being overheated or affected as all their body systems are developing. They can be negatively affected more by pollution and some of these climate impacts as well. Next slide, please. The number one killer out of all the list of climate impacts of health that we are now recognizing is heat. That unfortunately, as the temperatures rise, we are not human beings adapted to deal with some of these extremes in heat that we are witnessing in many countries across the world. And in Florida, where I am stationed here, we are seeing firsthand over the last few decades where there's a significant deviation of only roughly the historical average of 25 days per year, where the heat index, that is what we sometimes call the wet bulb index, it's the air temperature combined with humidity, that what your body actually feels like. You only had about 25 days per year of an air index of 100 degrees Fahrenheit, but this has substantially increased in only the last 30, 40 years. They are now saying that the numbers are about 105 days per year on average for the heat index. We were certainly seeing that in 2023, and that this is going to continue to increase by mid-century up into much higher levels, and perhaps even to the 140 days per year, where these dangerous levels of heat will be experienced by the community. Now, everybody is affected differently. We have different levels of vulnerability. If the heat index is at 90 degrees, the outdoor workers, such as agricultural workers, street vendors, for example, they may be susceptible due to prolonged exposure, due to having their bodies affected negatively. But as the heat index goes above 100, even people who may only be outside for short stints of time, or perhaps they only have a fan and they don't have air conditioning, they can start to have negative health consequences. And as described in the prior slides, this particularly can affect children and elderly adults. And as the heat index continues to rise to even higher levels, such as 105, it can affect each and every one of us, even seasoned athletes. They go outside on a run for a while, maybe within 30 minutes or longer, they can start to have negative effects, and they will have to get out of those conditions. conditions. So just a recognition that heat really is probably the first and foremost concern that physicians have to be mindful of in regards to the climate impacts on health. Next slide, please. I apologize that this is somewhat of a complex slide, more geared to perhaps a medical audience, so I'll try to kind of simplify it for the non-medical side as well. But all of you here probably are somewhat familiar that if you're outside in excess heat for too long, of course, you can have prickly heat sensations, muscle cramps. But over the course of time, if you are not removed from that environment, you can start to have significant dehydration. You can start to have stress on your kidneys, and you can also have demonstrable effects on certain people with conditions such as pregnant women. They can have increased risk for preterm birth. Of course, it can impact the development of their fetuses. And all of us, if you are in that situation, you cannot get out of this prolonged heat environments. You can start to experience heat exhaustion, heat syncope, or even heat stroke, which can be fatal. And those who have pre-existing heart disease or health conditions can actually be more predisposed. On the right here is just kind of a recognition that as the temperature rises, your heat threshold, as it goes up, it starts to go up much higher in terms of your relative risk. We've seen this in the population health data that in 2003, for example, the European heat wave there, especially as so many communities do not have air conditioning, resulted in tens of thousands of people, unfortunately, having premature death. And as physicians, it's probably important for us to kind of think in a risk stratification about which one of our patients are more susceptible for serious heat-related injury. It may make sense to those of you, like if they have obesity, have chronic illnesses, but there's also an important aspect of it where physicians with our prescribing practices, we do the best we can to get their blood pressure under control or get their diabetes under control. Certain medications such as beta blockers, diuretics, perhaps some anticholinergics, these medications that are the mainstay of primary care providers can actually affect the body's ability to cool itself and can predispose these people to become further dehydrated and unable to cool themselves down and may make them more predisposed to heat stroke or some of the feared complications. Next slide, please. Just also recognition that as the air quality can be affected, we can see that communities, not just in the local area, but communities hundreds of miles away can also be impacted. So this image here on the bottom left is a snapshot of some of the huge wildfires that were taking place in the Canadian wildfire area. Of course, in that local area where the wildfires were taking place, the air quality was atrocious. People were having worsening exacerbations of asthma and chronic obstructive pulmonary disease or what have you. But that wildfire smoke doesn't just stay there. It can travel miles and miles. And this photograph kind of demonstrates that there was increases in asthma exacerbations and all these morbidities and suffering of people in the Baltimore area and the southern mid-Atlantic states due to what is believed to be the direct travel of the wildfire smoke over the course of hundreds of miles. We also see that as temperatures rise, you have an earlier start for pollen season, and pollen season can last longer. So those of us who are primary care providers seeing our patients coming in with sneezing, hay fever, maybe chronic sinusitis, these symptoms can happen perhaps earlier than we might have expected, and they can last longer, and this can result in significant suffering on the behalf of our patients as well. Next slide, please. Just a quick summary slide. We've already talked a little bit about how wildfire smoke and these kinds of things can affect air quality. We also recognize that the biology of certain organisms, such as dust mites, can be accelerated. The reproductive cycles can be shortened as temperatures go up, and you can actually have increased dust mites, which can trigger asthma attacks. If you have large water storms, such as hurricanes, largely driven by low pressure systems. These will, of course, result in more water intrusion into homes. We see this all the time here in South Florida. And with water intrusion, impacts of roofing being compromised, you'll start to have mold in these areas. And of course, the downhill effects will have exacerbations of asthma, allergies, headaches, and what have you. If you have the ground temperature, especially in the water in those areas, starting to rise, you'll start to have more rapid reproduction of certain pathologic organisms. We have a Naegleria, which may be commonly known as like the brain-eating amoebas. Those kinds of amoebas actually do very well in warm, fresh water, and we are seeing, unfortunately, increased incidence of this as temperatures rise here in Florida. And as temperatures rise, especially in urban environments where there can be ground level smog or pollution, that ground level ozone becomes more powerful as the temperatures rise, and that can further irritate the lungs and the overall well-being of these patients who live in those conditions. Next slide, please. We do see that there is a growing linkage as the planet is warming, that you're seeing the increased frequency and the severity of extreme weather events such as hurricanes. So here in Florida, probably maybe that's the biggest thing on our minds. We don't have as much problems with wildfires ourselves, and that can certainly be an issue for those in the Pacific Northwest or in the northern parts. But we are mindful that we are seeing things that the Weather Authority are saying that they have not seen in their careers, the rapid intensification that can happen. So, for example, in 2018, Hurricane Michael was what was thought to be a tropical storm, Category 1 storm that was ready to hit the Panhandle. And in 24 hours, it went from a Cat 1 to a Cat 4. And a lot of those communities were not prepared for that rapid intensification. A similar thing happened with Hurricane Otis back in October of last year, with Acapulco, Mexico being devastated by this rapid intensification of water storms. Also, as the air warms, you can have more moisture being held onto that. I don't know if some of you remember, but there was Hurricane Harvey that had impacted Houston with tremendous amounts of feet of precipitation that can inundate and cause tremendous suffering there. And that's what was thought to be driving a lot of those negative health impacts on those communities. Next slide, please. This is a nice slide courtesy of the American Psychiatric Association, recognizing that it is important for us to see how the physical well-being of our patients can be impacted, but certainly there are mental health impacts that can be attributable to climate effects, as well as community impacts as well. So certainly I have seen patients coming in who perhaps after hurricanes or windstorms, or they may have happened a long time ago and they've had post-traumatic stress disorder manifestations, and we may need to be mindful of that. But there is an increasing body of literature on the population health side that, for example, as temperatures rise, you can start to see increases in interpersonal aggression. For example, in the hot summer months and in urban environments, such as in Chicago or so forth, the hot summer months can actually have increases in interpersonal aggression or violence and crime. And it probably makes sense that if you and I were hot and we're not able to get into cooler environments, it can start to wear on you and you start to be frustrating and perhaps shorten your temper. And these kinds of things will have to be thought of from a policy standpoint to ideally try to ameliorate the negative impacts it can have on the community cohesion. Next slide, please. As mentioned previously, we are recognizing that some of the greatest threats to the health and well-being of our communities may be due to vectors. Here is a picture of the classic mosquito. Next slide, please. And this is a nice demonstration about how, unfortunately, as temperatures rise, the mosquito habitat is expected to become much more broader, and that they will also be transmitting diseases for a longer period of time. So the Aedes aegypti is the most capable mosquito for transmitting the most concerning diseases out there, such as malaria and Zika. And you'll see here on this slide, I'm sorry, you'll probably have to squint to see South Florida there, but you'll see that there's just slight levels of orange there in South Florida, and that is where how many months a year the Aedes aegypti mosquito is actually able to transmit and breed. Next slide, please. And I don't know if you can appreciate this, but now you're seeing the vast majority of the Florida Peninsula, and certainly different areas that were previously not red, now turning red, and other areas that were blue now turning yellow. And this is just a recognition that these mosquitoes are actually thriving as temperatures rise. They have, of course, increased precipitation, increased hurricanes, all the water out there. They can breed a lot more effectively. Their reproductive cycles are accelerated, and they are then able to access more and more of the populations in different parts of the country, for example. Next slide. Some of the lists of the vector-borne illnesses that we are most concerned about are in this box below. There has been an unfortunate tripling in vector-borne diseases reported in the United States from 2004 to 2016. We'll go over that in the next slide. And we are recognizing that some of these public health measures that are needed to control these vectors, they often do not have the resources needed for critical prevention and control capabilities. Here in Florida, we are particularly concerned about dengue, West Nile parvovirus and Zika. For example, we never used to see dengue locally transmitted here in South Florida, but now we are. We're regularly getting Department of Health notice about being aware of dengue, and this is unfortunately thought to accelerate in the years to come, that we may start to see more and more, not just South Florida, but perhaps Central Florida being affected by some of these mosquito-borne illnesses. Next slide, please. This is just a snapshot of some of the increases in vector-borne illnesses from infected mosquitoes, ticks, and fleas. We do recognize that 2016 is somewhat of an aberration, that was when there was a Zika outbreak. And this again goes back to us here in South Florida. Miami-Dade County was one of the epicenters for a Zika outbreak for several months. We had sustained local transmission of Zika affecting many individuals, and particularly most worrisome, affecting many pregnant women that could affect their the pregnancies and their future children. So this was something that we were keenly aware of, and once again, a direct manifestation of climate impacts on health. Next slide, please. Okay, so I hope that served as a brief overview of some of the health impacts from climate change, and I'd like to hand it over to our legal colleague here to discuss further about the legal interventions that may be available. Thank you.
And if we can go ahead and launch the poll. And while you folks answer the question whether or not you're currently addressing health impacts of climate change through your MLP, I'll go ahead and reintroduce myself again. My name is Christina Russo Walters, and I'm the Senior Managing Attorney for the Medical Legal Partnership Unit at Community Legal Services. And we are a nonprofit legal aid that covers the Central Florida area. And for those of you on the call who maybe don't know what legal services are and legal aid is, before I begin, I'll just very briefly let you know. Essentially, it's no cost legal services for those who otherwise wouldn't be able to afford them in areas of civil legal assistance. And so with that, let's go ahead and get our poll results. So we do have some folks that are addressing climate change currently in their MLPs. The majority are not. And then we have some folks who, again, are not currently in an MLP, about the same split as our prior poll results. Thank you very much for that. And we can go to the next slide. And I want to say thank you to the Florida Medical Legal Partnership Network and Florida Clinicians for Climate Action. As Fred mentioned earlier, together we've done some work to create the templates and the legal advocacy letters that I'm going to go over with you all today. So I want to make sure we say thanks to them. Next slide. And I will be talking about advocacy templates in 3 areas: in housing, education, and employment, to give you an idea of how medical legal partnerships can work to combat the health harming legal needs of climate change. I want to also make sure to mention that this isn't the only way this can be done. Bethany mentioned earlier it was like a triangle shaped slide of the different ways that medical legal partnerships work. And also on there was training. And so training is a very big part of using these templates, having to train the clinicians on when to recognize patients who might be able to use them. And then also policy and systemic change can come into play when we're talking about climate change and the health harming impacts, legislative advocacy, and things like that as well. And so I just want to make sure that you all know that those are other options out there to address climate change through the medical legal partnership model. Next. So the advocacy templates are template documents that are made so that patients can assert and protect their legal rights. The idea is that these can be used by healthcare staff and personalized for each patient in their particular situation. And it helps to expand the capacity of the medical legal partnership. If you don't have a partnership, it also helps to expand capacity and the ability of healthcare staff to address legal needs still. And so it does this because by training the healthcare staff to recognize and use these templates, it allows more patients to receive them than if they had to meet each individually with maybe the one legal aid attorney who's partnered with the clinic hospital. These templates show the nexus between the accommodation or modification and health condition, and they help to create a paper trail that patients can use later on if they do need to receive representation from an attorney to have the modification or accommodation happen. These do not require that the patient be receiving or be eligible for Social Security disability. And the reason that I mention this is because the standard for disability for Social Security is a higher standard than those that are used in the laws that I'll be talking about with these templates. And for Social Security, so they do not have to have Social Security disability benefits or be eligible for those in order to be able to use the templates. The protections of the laws that I'll mention extend anyways. And then generally, we always suggest that you should draft these documents in conjunction with a legal provider. So if you're thinking about using templates at your healthcare clinic, institution, make sure that you're working with a legal provider to get those done so that they're in compliance with any state laws, local ordinances that might apply to you. You might have more protections in place than what I'll be describing in a minute. And the goal with these is to really have them part of the EHR so that when a provider recognizes that a patient has one of these legal needs, they're able to go in, make a few clicks, and you'll see kind of how the templates are set up for that purpose, and then hit print without a whole lot of additional work on the provider's part. Next slide, please. And so the first type of accommodation we'll talk about is in housing. And in housing, we have reasonable accommodations and modifications under the Fair Housing Act. And the Fair Housing Act protects folks against discrimination in a variety of areas, including disability. And so their disability is defined as an impairment that substantially limits one or more major life activities. And like I said, that's different than for Social Security would have been. And the key, the terms to know is that an accommodation is a change to a rule or service, like allowing a service animal, and then a modification is a change to the physical building. Next slide. So in the templates that we created, we actually created 2 different templates for housing. The first is an early termination of the lease agreement. And you're going to see, and with all of the templates, brackets. So in those brackets is where you would place certain information. And in the templates, if you were using them in the EHR, the idea is that the EHR would fill that information in, things like the patient's name, their address, the provider's name and address, that kind of stuff. And then on other templates, you'll see some drop-down menus and check boxes and things as well to help facilitate the completion of those. And so an early termination of a lease agreement is going to be an accommodation because it's the change to a rule or a procedure. And a reason that you might use something like this, if you have a patient who has carpeting in an apartment, for example, and there are no other non-carpeted units available to change them into, and the landlord won't remove the carpet, and they have allergies or asthma that's being exacerbated potentially by the carpet and dust involved in that, you can ask for a lease termination as an accommodation. Next slide. And then another example in housing, believe it or not, in Florida, we do not have a law that requires air conditioning. And so sometimes we need to use modifications, so the change to the physical building, to either request a repair to an air conditioning or it's for the installation of a cooling unit or fan. And that can be done through modification request, kind of similar to the accommodation one. And you see the example here. Next slide. All right, so reasonable accommodations in education is another way that you can use templates like this. Section 504 of the Rehabilitation Act gives students the right to accommodations to even the playing field. And again, the definition is substantially limiting one or more major life activities, so a lesser requirement than what Social Security would typically be. And some examples would be additional water breaks on class field trips and access to shade at recess. If you go to the next slide, we'll see an example of what that template kind of looks like that we've put together. And you'll see there we have it's check boxes. So if this was in the EHR, you would be able to check the different boxes on the screen saying, these are the different areas, major life activities where this student has issues and that or has limitations. And then at the bottom it's kind of cut off because this actually goes on to a second page, but there's an additional check boxes for what the accommodations are. And so here the two examples are water breaks when outdoors, access to shade, but accommodations for education can include lots of different things, additional time, maybe quieter spaces, things like that. And so these letters, while we're giving examples of how to use them related to climate change, there are also ideas that they can be used in other situations sometimes too. And then you can go to the next slide. And so the last example I'm going to give is related to employment. And so under the ADA, we can get reasonable accommodations in employment, and that includes any change to the application or hiring process or the job, or how the job is done. So as long as it doesn't change the essential functions of the job, and the person has again an impairment that substantially limits one or more major life activities. You'll see in the next slide that the template is similar to the other two, reasonable accommodations in employment. We have the drop-down menu or check boxes for what those different types of accommodations might be. But as Dr. Anderson had mentioned in his section, the increase in heat and other illnesses that are going around because of climate change, there's lots of different ways potentially to protect folks. Additional water breaks, shade, protective clothing, the ability to go inside for a period of time for break, additional breaks beyond what is typical, all things that can possibly be done through an accommodations request through the Americans with Disability Act for folks who have impairments. And we wanted to share some resources with you all where you can find some more information about the work that we've done with FC, with the Florida Clinicians for Climate Action, as well as a toolkit that Dr. Anderson has been able to provide from the Miami-Dade County Extreme Heat Toolkit. That is our contact information. If you all have any questions for us, we welcome you to reach out to us for any information. And I think at this time, I pass it over to Katie to facilitate Q&A.
Thank you, Christina and Dr. Anderson. So just a reminder, if you have any questions, you can pop them in the Q&A chat box or the chat box. We will see both of them. I know we had a few questions submitted during the registration process, and in listening to today's presentation, I wanted to pose those and maybe an additional question or two to our presenters. And I guess I'd start with one to both of you, which is, we know that how a disability arises or comes on the scene, you might say, doesn't matter for the purpose of legal protections under anti-discrimination laws. But it's also the case that climate-related health needs or climate issues and sort of new disabilities might cause some skepticism amongst whether it might be a landlord, a school, an employer, anybody who you might be seeking a modification or an accommodation from. And I'm curious what your thoughts are in terms of how, in particular, a health center, but all of our audience today, legal providers and others, can help their patients and their clients navigate this skepticism. For example, proving that a new or maybe a sudden health condition is actually a disability and entitled to the protections of the law. How can a health center, through those templates, help document both the disability and the health-related harm or need for an accommodation and justify the accommodation? Sort of what role can folks on today's webinar play as advocates and legal advocates, health advocates for their patients and clients?
I would say, especially for those health centers, clinics, hospitals, et cetera, to make sure that we're documenting things in the files clearly and with detail, right? So I know that a lot of times it's easiest to just very brief description of what's happened, the services provided, and that's typically fine. But when there's a patient with chronic conditions, maybe somebody who's trying to apply for an accommodation or Social Security benefits, I deal a lot with those in my day-to-day work. It's really important that the patient's symptoms are documented and that the limitations as well are documented within their files.
And if I may add, so Katie, you do address, it's not just perhaps the landlords or so forth. There is maybe a little bit of confusion just about the terminology of disability, since it has different definitions. That
Right.
when we've had the privilege of working with providers to educate them on this, that they often are like, well, what, don't they have to go through social security? Like, what do you mean?
Right.
Do I even have that ability to declare somebody having a disability? Like, they themselves can be uncomfortable with that.
Mhm.
And we can seek to reassure them that we're really just, once again, drawing that nexus between their health condition and the way they're being impacted on the accommodations that they're legally entitled to.
And I think there's also in a similar vein, the patients or clients themselves don't always understand or know that the health needs that they have or the symptoms that they are experiencing might rise to the level of a disability as defined under any of these laws, but for this purpose, under the Americans with Disabilities Act or Fair Housing Act or the Rehab Act. So some education all around, and hopefully this webinar helps everybody feel empowered to use those tools and those resources and have those conversations, so that if a patient is really struggling because of a climate connected health need, that they get these modifications and accommodations that they need. One of the questions that came in, I think I'll post this to Christina. Is there a difference between partnering with legal aid attorneys versus attorneys specialized in environmental law? And I'll just take the liberty of extending that to maybe disability law, since we're talking about that intersection. And I think this is a practice question. If we have legal aid attorneys or even health center staff on this webinar, what would be your approach if they do want to start incorporating climate change into their MLP in terms of who they should partner with?
So legal aid attorneys tend to have at least when you talk about like their organization as a whole, will have a variety of different areas of civil legal assistance that can be provided. So I mentioned here, we've talked about education, housing, and employment. Those are all three different areas of law that a legal aid attorney, maybe one won't be able to assist with, but the organizations tend to. Like our organization, we have 10 to 12 different areas of law that we cover. And so you have that kind of general list in terms of civil legal aid. If you're going to a private attorney, you might have a more narrow practice area focus that they might be able to assist with. So I guess it would depend on what your goals are with the partnership and what you're trying to do.
And perhaps also those legal aid attorneys are networked just like a lot of professionals, and will have connections and knowledge of maybe specialists in other areas of the law that they talk with to get guidance to work on cases or issues together.
Right. We also depend heavily on a pro bono workforce behind us to help expand our capacity. So just like many of the clinics will have volunteer doctors or students come put in their time, we do the same with pro bono attorneys as well.
Great. So Cheryl asked this question: for an outdoor worker with chronic disease who may be undocumented, would they be able to use this ADA accommodation?
So the accommodations of the ADA protects anybody regardless of their immigration status. Things get a bit more complicated when we talk about immigration status, because there's always the threat the employer can make reports and things of that nature. Unfortunately, that's kind of the nature of the beast when it comes to those things. But the ADA itself does protect folks who would be undocumented.
Great. Another question I think that I wanted to pose is a little bit about the intersection between the ADA and, for example, occupational safety and health, in thinking through some of the accommodations that a worker might need because of climate change, because of environmental reasons. Do you have any experience or any tips on how to navigate that? For example, there might be, because of extreme heat, there might be accommodations that would frankly benefit all workers who are working, heavy labor in extreme heat. And yet there might be other accommodations or the same accommodations that are just more critically important for a person with an underlying condition. Any tips or thoughts that you might have on how MLPs can navigate those two areas of the law?
So we don't do a whole lot of legislative or policy work at CLS because we are LSC funded, but Dr. Anderson, I know there's a group in Miami that's doing a lot of work kind of related to that stuff. I don't know if you want to mention, I can't remember the name off my head, I'm sorry.
Yeah, so we should probably just recognize that Florida, our policies here may not be as robust as other states, frankly, when it comes to climate mitigation. We are frankly learning a lot from what perhaps California, Oregon, and state of Washington are doing for protection of outdoor workers. And there they do have state regulations to try to protect outdoor workers, agricultural workers, to have mandated shade breaks when temperatures rise to a certain level. Florida has not had that yet, but there are local organizations. One in particular called We Work We Count, excuse me. We Count is a local agricultural worker collective or advocacy organization pushing for local city ordinances on this. So we recognize that the legal landscape is shifting. A lot of it depends on policy advocacy, and that is the one caveat. Maybe Christina can speak to this more. That our templates that were crafted largely with Florida law in mind for some of the elements, and so that you may just have to keep that in mind, that they may not be readily applicable for your state environment as well.
A good reminder that. Go ahead.
I'm sorry, I just want to say that the 3 laws I mentioned today are federal regulations, though. So
but a good reminder of the need to personalize and check with the legal provider so that whatever template you are using has the ability for the provider to personalize it for that patient, and that it is consistent with your state and federal law and the interplay between those two.
Right, because as Dr. Anderson mentioned, a lot of other states do have more robust protections. You would think being in Florida, we're surrounded by water, we're a very warm state, that we might have some additional protections. It looks like our legislature is actually working to kind of go backwards on some of the more local ordinances that have been passed in recent years to offer protections. But if your area has greater protections, you would want your templates to be more tailored to what those requirements are, relying on the ADA as backup, but also to say, your local ordinance requires this, this, and this in addition to that.
Right. And like you were saying, the templates are based on, or the legal protections you discussed are federal law. So even in the absence of some local occupational safety or health regulations, strong regulations or protections, there is still the ability, if the circumstances call for it, to use the ADA or other laws to perhaps seek an accommodation or a modification for an individual patient. A question here is, I'm wondering if Christina and Dr. Anderson, if you can share what you would consider maybe a first step for healthcare or legal services providers who are just getting started on climate change and action. Where should they start? What might you suggest that they focus on first?
So I would start with, if you're a healthcare side, start by reaching out to your local legal aid. There is one that covers every county in the United States. So there is somebody who covers the area that you are in. I would start by reaching out to them and seeing if this is something like templates, for example, is something they'd be willing to work with you on, or to take it a step further, and if they would be willing to explore actual full-on medical legal partnership with you. Because while we talked about templates, that's just a small piece of what we can do with an MLP. And so there's a lot of really great impact that we can make with a full embedded partnership.
And I would add, Katie, for perhaps a healthcare provider side, that there are fortunately a lot of good people doing great work on this. The Florida Clinicians for Climate Action, of course, is a resource for Florida-based practices, but there are a national consortium. It's called the Medical Society Consortium of Climate and Health, which serves as somewhat of a repository for expertise on the national level, can help connect individuals. If you happen to be in a state where there is an organization like the FCC is for Florida, that might be a natural connection to find like-minded providers who are looking to make a difference in this field.
That's a wonderful resource. We should share a link to that. On the vein, I think, Dr. Anderson, you were talking about sort of what Florida is learning now, given the specific climate-related challenges in Florida that might differ from some other areas of the country. Somebody asked, generally speaking, what are some lessons learned that might be applicable for other sites in the country? So recognizing that the particular climate challenges might look different based on where you are in the country. But as you both have been doing some work in this area and leading the way with the MLP approach, any lessons learned or things you might have wished you'd known at the beginning?
Sure. So I kind of did cursed over this pretty quickly, but everything is local, right? So Miami, we are very susceptible to hurricanes. We have fortunately had a very good culture of preparing for hurricanes here for decades, that people are used to. Starting at hurricane season, you start getting ready. But there's similar efforts now to change the mindset in the public about preparing for heat season. And Miami-Dade County has been leading on this in many ways. The county mayor is very progressive thinker in this regard. And that's one of the resources that we shared, is the Miami-Dade County Extreme Heat Toolkit, so that people can start preparing, having access to shade and all those kinds of things. But that if you live in the Pacific Northwest, it's probably going to be a little bit different. There, you may have to be more concerned, frankly, about wildfires and being careful about looking at the air quality index and maybe including that as part of our usual routine for people with chronic airway disease. That, don't just look at the temperature. What's the AQI out there? Because you may need to wear a mask or limit how much you're outside. And that goes to a lot of the public health education that you may need to engage in with your patients. Perhaps you're in the Northeast, and where Lyme's disease is much more. I don't have a one size fits all caveat, but hopefully we touched on very briefly all the different ways in which climate health impacts can manifest themselves. And there are different organizations out there trying to think about how to be proactive in planning to be more resilient in this regard.
A really good point about all things being local, because you are sort of the expert on what the issues and the challenges are in the area where you live and work, and then it's probably a matter of knowing the full universe, connecting to resources, learning from others, and starting to use MLP to help on these issues. I will put out a call. We have just a couple of minutes left for any additional questions or any final thoughts from our presenters. I don't hear any. So Bethany, I'm going to turn it over to you to close us out.
Thank you so much, Katie. Greatly appreciate it. And just want to put in a plug for Cheryl Holder, who also shared in the chat, just reiterating, reemphasizing that the Clinicians for Climate Action type organization, there are about 32 states with those organizations. So just adding to what Dr. Anderson referred to, take a look at that Medical Societies for Climate Health.org website. I want to sincerely thank Christina Russo Walters of Community Legal Services of Mid-Florida, as well as Dr. Frederick Anderson of Florida International University Mobile Health Center, which is, by the way, showing up on the background of the screen. Folks are interested in that mobile health center, feel free to reach out to them to learn more about all of the services they provide. But I want to sincerely thank them both for taking time to help people better understand what is climate change, what are the health harming effects, and how to really utilize MLP as a strategy for addressing the health harming effects of climate change. Yes, it's the greatest challenge of our lifetimes, but we also have interventions that we can utilize now and prepare for over the next decade, and starting now, to be able to address the needs of all of us, quite frankly, not just the patient and client populations that we serve. Christina and Fred, thank you so much for joining today. And to the audience, we hope you feel empowered by the information that you received. Feel free to reach out to us. One of the very first things you can do is take a moment to complete our survey and let us know how this webinar helped you. We'll plug it in the chat. And again, the survey, the slides, along with the survey link, will be posted on the National Center for Medical Legal Partnerships website, as well as the Health Center Clearinghouse. I want to also thank our colleagues, Katie Hathaway, as well as Reha and Jackie, who are on and have been working behind the scenes. You can look forward to hearing from us again about MLP in action and how it addresses the needs of the patients and clients that are served in these communities around the country. On the 23rd, we'll be joined by Futures Without Violence, or Health Partners on IPV and Exploitation, for a webinar that talks about how we can do emergency preparedness and address the needs of individuals through MLP as one of those multidisciplinary collaborations. And then also you can join us on February 1st. The SCOH Academy will be presenting the third of our 4-part webinar series. please continue to join us on these training events. We know you're all very busy. At least sign up so you can receive the recordings after the webinar. Again, Christina and Fred, thank you so much for today's presentation. And to the audience, thank you. We'll see you next time. Thanks, everyone. Bye-bye.